Hi, good afternoon, everyone. Thank you so much for being here. My name is Aditi. I manage the healthcare life sciences vertical and also the growth business for Salesforce in India. Been here for a little while. Before I start, I wanted to just, this is customary in Salesforce. Whatever I speak today, if you hear some forward-looking statements, please do make your purchase decision as per what's available today. So thank you so much, firstly, for being here today, taking time out to listen to us. Thanks a lot. Some of you are our customers. Thank you to our customers for trusting your business with us. Thank you to the partners and the trailblazers who are sitting here. Thank you for making us who we are today. We have been in India for over 10 years. We are a 22-year-old company, and we wouldn't be where we are had it not been for your support. So thanks again. Let me get started. We started the presentation at Salesforce for Health, and the title said Relationship at the Heart of Health. Now, the reason why we say that is because all of us today are health consumers. Being health consumers, I don't think any one of us looks at each of us as a patient at all. And one of the main reasons why we don't look at ourselves as patients and more as health consumers is because our research says nearly 90% of health of a person is determined by the social factors, by the ecosystem that we thrive in, our relationships that we have with our doctors, with our caregivers, with the pharma companies who are serving us, the clinics and hospitals. That's the very reason that it's so critical for every single organization who is involved in healthcare and life science to build and keep this relationship at the heart of the entire conversation. Now, it's obviously easier said than done. Right? It's easier said than done because relationships are not very easy to build given the regulatory landscapes that we all live in. None of the pharma companies specifically can even own the customer data. The problems get compounded, and these are just some of the things that we wanted to put together. This is from the World Health Organization website. Right? If you see, we picked up some 4 key metrics to highlight the kind of headwinds that the companies today are facing. Pandemic accelerated this. One of the biggest problems has been of a workforce shortage. Now, this workforce shortage is not just putting pressure on health consumers like you and me. It's putting tremendous pressure on the healthcare professionals, and as a result of which, the leaders who are dealing with these individuals, the technology teams, the operations, supply chain teams, they are in turn under tremendous pressure. The second thing which the Viva team also spoke about, and it's a known fact, we all live in a hybrid environment. Right? The hybrid environment necessitates that we are available where our stakeholders are available. The stakeholders, healthcare professionals, and the healthcare consumers expect that they will get the care and answers to their question when they want, where they want, at that moment. So the moment of truth and being present on where they are is absolutely critical. And this was a really surprising metric. I intuitively thought the highest amount of data is getting generated by banks or financial organizations today. But when you really dig deeper, nearly 30% of the world's data today is being generated by healthcare companies and healthcare consumers and stakeholders. I mean, look at the proliferation of the wearable devices. Look at the way the public health services in India and across the globe, how much data they are generating by going closer to the customer through various digital initiatives. The trick is to get this data, mine that data to drive intelligence insights. And last but not the least, the most important factor is the health inequality that exists in the world today. And it's a problem that not just the developing worlds face, but it's a problem that is faced by different nations at different levels of maturity. And this is putting tremendous cost and financial impact on the healthcare organizations and the public health services companies. And that's why when you think about the relationships, the criticality of relationships, and the headwinds that the healthcare life science companies are facing, there's clearly a divide between the healthcare organizations and the healthcare consumers, right? We do a lot of consumer surveys, stakeholder surveys, and one of our surveys told us that 46% of the healthcare life science customers, healthcare and life science leaders believe that they do not collaborate effectively with individuals across their organizations. It could be clinical trials, it could be at the front end. They are not able to do it. And one of the biggest reasons they are unable to do this is because of the hybrid nature of work, the diverse workforce that's existing across geographies. And they're working as per time zones and not across geographies. In fact, 60% of these individuals believe they want to continue to work in a hybrid mode. Add to that the increasing administrative tasks. And my favorite is the consumerization. The consumerization has hit healthcare and life science companies as well. Pharma, hospital provider, payer, all of them are dealing with consumers who are more aware and who benchmark themselves, or rather the companies that they deal with, against the best in class. The pharma companies and the providers are being the providers. For example, we were with some of the leading providers recently, and they said, how can we deliver a hospitality-like experience to our patients and health consumers? All of this means only one thing. You got to put the relationships at the heart of your healthcare strategy. And that's where we come in. You need a solution. You need a strategy that puts the healthcare consumer and the healthcare stakeholder at the center of your strategy. The survey that we did recently told us that nearly 92% of the leaders believe that the best value that they can deliver to their consumers will be derived from the technology strategy that they have. A technology strategy they believe will be a make or break on the value that they deliver to the customer. So once you start putting your consumer at the center, how do you start collecting data about your consumers and the stakeholders? How do you build on that data? How do you uniquely identify these individuals and reach out to the individuals at their preference of location, of time, and with the content? How do you create loyalty? And do all of this within the regulatory framework of your company in the geography that you operate in. And that's what Salesforce does really well. Salesforce, most of you, I hope, must have heard about Salesforce to be world's leading CRM software. Our Customer 360, the customer engagement platform, which we call Customer 360, has been powering customer relationships by putting the customer and the consumer of that organization at the heart of their business. In the last couple of years, we have spent a lot of our R&D dollars in building vertical solution. What does that mean? We have invested a lot of money in learning about industries and creating industry data models by taking a lot of professionals from the industry into Salesforce and building this out. And one of the most successful business models, one of the most successful data models that we have built, we call it Salesforce Health Cloud. Salesforce Health Cloud and it is across pharma, provider, payer, medtech companies. Different flavors exist with out-of-the-box data models, which can be applied right from the time when the health consumer is unknown to the time to servicing the consumer and connecting the consumer with the healthcare professional. And we understand it's not that easy. It's not that easy for you to just take even a vertical data model and implement it for your solution because there are so many nuances that exist. And that's the reason there are 3 critical things I wanted to leave you all with. Number 1, you may have heard about AppExchange. It's the largest B2B app exchange platform that exists in the globe today. In fact, just a fun fact, the Apple App Store was the original name for our AppExchange, and our founder, Mark Benioff, gifted that as a gratitude to Steve Jobs. So AppExchange is a platform where we have over 9,000 independent service providers building application purpose-built for your industry, for your geography, for your specific use case. For that matter, Viva's sales and service aspect of their business is actually also running on Salesforce. They are one of our esteemed ISV partners, and they've done incredibly well. IQVIA is another one. And there are many, many more. SimCloud for the quality management. There are many more partners. If something suits your need, which is not out of the box in Salesforce, look at an AppExchange partner. The next thing that I wanted to highlight, which is on top of every commercial officer, IT officer's mind in a healthcare company, how fast can I go to market? Pandemic really accelerated outcomes, need for faster outcomes. And in order to enable a fast time to market, Salesforce as a platform is a low-code, no-code platform. Our philosophy is configure and not code. And this helps you deliver the outcomes much, much faster. And finally, something that we have done for 22 years very successfully is how do you create personalized one-to-one engagement? We recently launched a real-time data platform called Salesforce Genie. Our customer data platform enables all this conversation by bringing all of the customer data together in one single place for you to decide what outcomes you want to achieve. We don't just stop at giving you ideas. We obviously also measure our results. And when we went about measuring the results, we have tons of customers in different subsectors within healthcare life sciences who have achieved fairly good success. Some of the things that we have heard consistently from all of them, number one, by connecting the systems together, by breaking down the data silos, by collecting the data in the manner where you uniquely identify your stakeholders, we were able to dramatically increase the collaboration across individuals. Slack is one of the tools that a lot of organizations like AstraZeneca, they use very successfully to collaborate amongst their peers, even during the clinical trial phase. The second thing that we heard from our provider ecosystem is increase in agent productivity. By ensuring that there is single view of the customer, healthcare consumer that they are dealing with, by ensuring that there is a single view of the doctor that they are dealing with, they are able to successfully fulfill the demand, and that led to a dramatic increase in their productivity. And finally, increasing the top line, which is the agenda of each one of you who's sitting here. Impacting the top line by delivering customized, personalized journeys is what helped us succeed in a lot of customers. There's lots more we can talk about. I would love for you to see a stall. I'm sure some of you would have already seen. The Salesforce Health Cloud, the website, you can go and visit the website, healthcloud.com. We have got Health Cloud flavors for pharma, provider, payers, and medtech. There are short demos available. We'll be happy to talk you through it. You can walk up to our booth. We will be able to show you the demos. Very excited to hear your feedback and views. With that, I would like to end this. Thank you so much. Looking forward to interacting with you.